Okay, I think we're rolling.
All right.
Let me see. This is a bit. Yeah, I have to step back a bit. Okay. We're standing at a healthy housing lounge sponsored by Kaiser Permanente. What would a health insurer do with housing?
Well, Kaiser Permanente is one of the largest integrated health systems. So we provide care and coverage to over 12 million members here in the United States. And as an organization, we truly believe that for us to be able to optimize the health and well-being of our members, we have to be thinking about the conditions for health in the communities where those members live. Because we also know that only 10 to 20% of what impacts health happens within the four walls of the health systems. Most of what impacts health happens out in the communities where those members live. It's the individual behavior, personal behavior, it's the social and economic factors, it's the built environment. So housing is integral to health, and that's why we're involved in this effort.
You are driving at reducing homelessness. Is homelessness a health issue?
Well, if you think about homelessness and health, they are directly interconnected. We know that a homeless person life expectancy is 27 years younger than those who are housed. We know the mortality rates of people who are homeless is 3 to 5 times higher than those who are housed. We know your healthcare costs are much higher if you're experiencing homelessness. If you're admitted to a hospital, you stay 2 to 3 days longer. If you are discharged from a hospital, your chances of being readmitted to the hospital are 50% higher. So the connectedness, if you want, the connection between homelessness and health are critical.
Yeah, and these numbers also have financial impact, right?
Yeah, absolutely. I mean, at the end of the day, if you're admitted to the hospital and stay 2 to 3 days longer, if you're admitted to the hospital, discharged, then you have to be readmitted. If you have higher rates of disease, burden of disease, chances are your total cost of care is also going to go higher, on top of having a lower quality of life for you as an individual.
Kaiser has allocated some serious resources for this new project, right?
We did. So back in May of 2018, we've allocated $200 million for impact investment to preserve and expand affordable housing. And those are not grants. Those are investments that we're making in the community to build or preserve affordable housing that would still give us financial return on investment, but most importantly, it's going to give us the social return on investment and making sure that people continue to be housed.
So what are your aims for, say, the next 4 or 5 years?
Well, for the next 4 to 5 years, we want to make sure that we're investing those dollars in the right way. We want to make sure that we're preserving and expanding affordable housing. And we want to make sure, as part of our partnership with Community Solutions that we've announced this morning, that in those 15 communities that we're working in, we're getting to a point where we're ending chronic homelessness in those communities.
Thank you.
All right. Great.
Awesome.